Studio production begins in 5, 4, 3, 2, 1.
Welcome to this edition of Community Foundation Spotlight, where our focus is on philanthropy. I am thrilled to be joined today by Dick Van Gelder, who is the community chairperson for the Mission of Mercy program. And he's going to tell us a little bit about this year's planning for next year's event. And I am so thrilled to have you joining me. Thank you, Dick.
Well, thank you, Erica. And we're so excited to have the Community Foundation as a partner in this wonderful community health project.
Now, this is the second time that the community has come together to provide this tremendously valuable service. We live in a wonderful place here on the Lower Eastern Shore, but like any community, we are not without our challenges. And that's where the generosity and the giving spirit of this community really come together. And Mission of Mercy is a perfect example of that. Can you tell me the basics of our upcoming event in 2015? Who is eligible to participate in the Mission of Mercy program?
Well, the Mission of Mercy program is an adult-free dental clinic. It's open to adults because children are provided oral health care through the school system and the county health system. But for adults, there is no available resource for health care if you can't afford the out-of-pocket costs or if your insurance company doesn't provide for that. And this program is really targeted to a lot of the working poor in our community that have a job or may not have a job, but probably have a job, may have dental insurance, but have limited dental insurance. And dental insurance actually doesn't cover a lot of the out-of-pocket costs associated with oral health care, good oral health care. So what people do is they defer the need for oral health care, and that leads to complications and problems either with infection or with decay, with loss of teeth. That leads to self-esteem and a lot of issues like that. So this program is targeted for adults 18 and over. There are no income requirements, there are no insurance requirements, there are no insurance co-pays, there are no geographic requirements. So we found in 2013 that we served residents from all over the Eastern Shore, both Maryland and Delaware, and we actually served residents from the Western Shore that knew the event was going on and understand what the Mission of Mercy project brings to communities.
And I think that highlights the impact and the debilitating nature that those kind of dental issues and problems can cause for individuals. And it's so wonderful that the community is once again coming together to do that.
It's amazing, it is.
Now you've got the date scheduled.
We do, April 17 and 18. That's a Friday and Saturday, April 17 and 18, 2015, at the Wicomico Youth and Civic Center, just like it was before in 2013. Friday and Saturday are the clinic dates. The clinic begins at 6 a.m. each morning. There are no appointments at all. It is all first come, first serve. And based on what we saw in 2013, it certainly would be important for anybody considering it to be there early, be there the night before. We found people beginning to line up. As we closed the clinic Friday evening, they were lined up to come in Saturday morning. So it's a long night of waiting. Dress appropriately. We hope the weather will be better in April, the middle of April, than it was in March a year ago. But it's April 17 and 18, beginning at 6 a.m. each day, and we'll see as many people as we can.
And I know that last time, of course, there's significant resources in terms of dollars, but also the volunteer need.
Gosh, yes.
I mean, this is really a project that is truly driven by volunteers. Without them, I don't think that something of this scale would be possible. How many people are you trying to get engaged as volunteers for this project?
We need approximately 1,200 volunteers, and that is dental professionals and general volunteers. On the dental side, there probably will be about 200 dentists supported by hygienists and dental assistants. But on the community general volunteer side, that leaves us 800 or 900 community volunteers needed to staff and manage the logistical effort that the dental clinic handles, because we have to move people safely around the building. We have to staff patient registration, patient waiting, patient reception areas, their on-deck areas, their hospitality areas for the volunteers.
And all of this is at the Civic Center?
It's all at the Civic Center. We will transform the Civic Center into a full dental hospital And hopefully, last time we were able to treat 1,000 patients.
And I know your goal's a little higher.
It's higher this time. We'd like to get to 1,500, 1,800, maybe 2,000 patients. And we're going to be able to do that with the financial support of the community. When you talk about philanthropy and the wonderful heart that is Delmarva, it is the time, treasure, and talents. It is the time of volunteers, the 1,200 plus volunteers that'll help with the logistical effort. It is the donations of the community and the businesses in the dental community around the country that support the project.
Now you're looking, those volunteers, there's information, I know you guys have been diligently working for many months already in the planning of this and have a number of volunteers that are helping to lead that. If people in the community want to get involved or want to keep tabs on the planning and the details, how can they find that information?
Our website is the best resource, whether it's for patients or for volunteers or for donations. Our website is the best place to go.
Perfect, and that is?
www.easternshore-missionofmercy.org.
Perfect. Now, we would encourage all the community members who think that they might have some time or some dollars that they would like to donate to this tremendous cause to visit the website for that. We worked with you at the Community Foundation last time to help with the receipt of donations for this program, and we're doing that again this time.
Thank you.
And so individuals who want to donate can also go directly to our website, which is www.cfes.org, and there's a link right on our homepage for donation, and Mission of Mercy is one of the selections from
That's
that.
wonderful.
So we've tried to make it as easy as possible because we know that there are so many generous individuals and businesses in the community that helped last time, and we would encourage them to try to do that again this time, maybe a little bit more if they can, since the goal is higher for service.
It is higher.
Now, can you tell me a little bit about some of the successes that you had last time? I know that some of the personal stories that I heard from individuals who were served and the community partnership that happened at that event were really just transformative for many of the participants at the clinic. Could you share some of that with the viewers?
Well, I suppose there are 1,000, because we treated 1,000 patients. There are 1,000 individual stories of people who came and stood for probably 10 to 12 to 14 hours waiting to get in, hoping to be seen and treated, and that received some level of care. And the important thing for patients to know is that we can't correct and fix and treat the entire scope of problems that have developed over years of deferred dental care. If you haven't gone to the dentist for a long time, you have a lot of problems. What we try to do is address either infection, pain, or a life-threatening condition such as an oral cancer. So we will try to focus on pain and infection primarily, spend an hour with a patient doing whatever we can, whether it's an extraction, a root canal, a restorative, a filling type procedure, or a simple dental hygienist providing cleaning services. But as people left the clinic last time, it was transforming, as you said. It was overwhelming to see people who had multiple teeth extracted, who had gauze in their mouth, and were still bleeding from the surgical procedure, with tears of joy walking out of the building. The most touching was one of the last patients was a lady who for 28 years, she works in this community. For 28 years, she had provided for her 4 children while they were growing up, took care of everything they needed, but simply could not get to the dentist herself and afford that kind of care needed. So after 28 years, she had 8 teeth extracted, but she left in tears of joy. She hugged the dentist when she got up because finally she was free from the pain and infection that she had been experiencing for so long. We had a Western Shore gentleman that came, and he was threatened with what's called sepsis, which is a severe body infection that can actually lead to death. He was threatened with that infection because of complications in his teeth, and he drove from Frederick to our Mission of Mercy to receive care, to have some teeth extracted to try to eliminate that threat and problem in his life.
And so it really is life and death for
It
some of the
truly is.
participants that are there, but also just to get that much needed care for all the individuals. You said that there were people from all over the area and surrounding region, but the vast majority of individuals served at the last Mission of Mercy were local folks from right here in our community.
Local folks, and demographically it's interesting that the largest age group of people that were treated in March of last year were between 18 and 30 years of age. They were
Very
young
interesting.
people. It wasn't older people, it wasn't homeless people. These were again the working poor, these were the friends, family, and neighbors who had deferred dental care and needed that resource.
And maybe in some of that category, like you were talking about, with the people who were deferring that because of a need to take care of children's needs or other things, and making others the priority. So
Budget priorities just drive that whole list of where money's going to go, and sometimes people let dental care go.
Now, I remember that last time there were some side benefits that we can touch on during, the waiting period, which is quite long, but it certainly speaks to the need that people are willing to make that commitment. But you had other partners involved who provided additional benefit, and so tell me a little bit about some of that sort of community that was formed at the MOM event.
We had a local ophthalmologist, Dr. Jeff Benner. He's a vitreoretinologist, a specialist actually, that asked if he could gather the resources of some optometrists, some ophthalmologists, and the Lions clubs from the area to provide vision screening and eyeglasses. And so last time, as part of our waiting area, we had a vision screening and eyeglass program, and they were able to actually screen 436 patients and give them free eyeglasses because of the generosity again and the philanthropy of the community, donating their eyeglasses that aren't needed to the Lions clubs. The Lions clubs had amassed about 6,000 pairs of glasses. They were able to bring that inventory of glasses to the health fair, and while patients were waiting, they were able to match prescriptions for patients after they were having a vision screening. So we hope to provide that again to patients. It is not separate from the dental program. It's simply while our dental patients are waiting, if we can help them with some vision help as well, we will do that. But it is not a separate program.
Right, so they're there as part of the dental
That's correct.
clinic. And so I would imagine that that was the first time that you had done it in 2013. It was tremendously successful, but like with any project and any time you do something the first time, you learn lessons and you find ways to improve. I know you've increased your goal for serving patients, and so that tells me that you know that you have things in mind to do better or to do more this time. What were some of the lessons that you took away from that first event, you and your partners and volunteers?
Probably one of the most difficult lessons was the decision do you treat one person with a lot of things needed, or do you treat a lot of people with one thing needed? And it's a terrible place to be when you have limited resources. Do we treat one person with a lot or a lot of people with one? And we've decided this time that our focus is going to be to try to provide 1 hour of dental care for each patient. And we're doing that with the support of not only the Maryland State Dental Association and Eastern Shore Dental Society, but the Delaware State Dental Association is also participating and bringing dentists to the clinic this time. So we hope that with more dentists and with a focus of 1 hour of treatment, which means prioritizing what can we get done, what can we fix that's most critical in that time frame, that we'll be able to reach more patients. That was one of our biggest goals, one of our biggest things that we realized last time that we had to do. It was difficult to turn people away, and yet it was difficult to say to somebody, we can't do all that's needed in the time provided.
Now, I know that there were clients that came down from Delaware, and so the partnership that you have with both the Maryland associations but also with partners in Delaware is really tremendous, because on the Delmarva Peninsula, we know that
it's a region. It's
a region, and our problems or our challenges or our opportunities don't stop with the county lines or the state lines, and so that's a wonderful opportunity that you've done to bring those two states together and partner with the organizations. In terms of the volunteer activity I know that's a huge goal, and something that people can get involved with by visiting your website. Let's talk for a minute about the financial piece, because there's only so much that can be done with the time and talent. The reality is that you all also need the treasures of some of the donors in the community, and they really stepped up last time. What is your goal in terms of finances for this project?
There are two aspects to the financial side of providing this. Now, put it in the context that we're going to transform the Civic Center into a 130-bed dental hospital for 2 days. And everything that is involved in that is, first of all, the rental of the dental equipment, the 130 dental stations that are needed. The cost for that is about $45,000. The second thing are the supplies and disposable consumable products that are needed in the care of 1,500, 1,800, 2,000 patients. That's again about a $40,000 budget expense. So we have cash needs. Our cash budget is somewhere in the $175,000 range. That helps us supply this, put the Civic Center together, supply all the dentists with all the instrumentation that they need. And with pharmacies, local pharmacies coming in and donating their time and talents and pharmaceutical products to provide antibiotics for patients. So cash-wise, our budget is $175,000. Beyond that, we have tremendous donations of in-kind services from organizations, from companies, both in and out of the dental community.
And items as well, too. I know that there's been...
well. Bottles of water from companies around the shore, and for a volunteer refreshment area and hospitality area. Donations of food products for the hospital. We take care of the volunteers for all 3 days they're here. So when the 1,200 volunteers come, we keep them happy and engaged in the workplace for the 3 days that they're there, through tremendous donations throughout the community.
Makes it all come together.
It really does. It really does.
You're watching Community Foundation Spotlight, and I'm Erica Joseph, and I'm joined with Dick Van Gelder, who is the community chairperson for the 2015 Mission of Mercy Project. We're talking a little bit about your needs, your opportunity for this coming event. Let's remind viewers about the website for information, which is
www.easternshore.missionofmercy.org.
And that has all the information, the dates for this event. It'll be at the Civic Center. It's in April. You remind viewers.
April 17 and 18, 2015, beginning at 6 a.m. each Friday and Saturday.
And you need volunteers, and that Eastern Shore Mission of Mercy site is the perfect place to get all the information. And if individuals want to make contributions to the Eastern Shore Mission of Mercy Fund, they can do that through the Community Foundation's website as well.
That's correct.
www.cfes.org. We're thrilled to be a partner again with you this year. Tell me a little bit, you've talked a little bit about some of the changes that'll be happening in terms of the focus and how much time. Do you have the sense that there are any new efforts that'll be part of this particular program this time, or are you just going to try to do the same level of service from last time, but better and a little more efficiently?
I think that sums it up. We're trying to achieve the same level of service with some more efficiency, some small record keeping and data management changes that we're making. We've a simple thing, like we've relayed the clinic floor so that our surgical area will be closest to the exit area, because those folks were, after waiting for 12 hours, having surgical procedures done. It sounds silly, but to have to walk from the back of the building to the front of the building was a lot to ask of them. So it's a simple change, but we're hoping that with the success we had last time, if we can tweak some of the small logistical efforts we made, that'll be a tremendous difference for both patients and volunteers. And I should mention that on the volunteer side, no skills are needed, just a heart and a smile. That's all we really, really need, and we can do the rest.
And you've got, and I recall from last time, I knew many individuals who were part of that volunteer effort. And as you say, doing something the first time is often what you need to know how you would tweak it a little bit differently. But you had a range of needs and so much organization around getting the right volunteers to the right spot and the right job, regardless of what experience they had coming into it. Now, one point that I do want to make, we were talking earlier in the program, and as a reminder to the viewers, that the focus of this clinic is specifically on dental care for adults.
That's correct.
18 and older. And so you're discouraging the attendance of children at the event at all.
Not permitted at all on the Civic Center property. Please, we have a good heart, but we have no resources to care for, to provide for, attend to children while you're waiting or while you're being treated. So no children are permitted on the property at all.
And for that level of dental care, for some of the individuals, I would imagine that they're not feeling 100% afterwards, and so having someone help provide that care for kids while they're there focusing on themselves, certainly advisable.
They're apprehensive in the first place, which is maybe one reason why they haven't gone to the dentist. So they're apprehensive in the first place. It's very stressful. It's a lengthy day for people, and we don't need the complication of children as well.
This will help it all go smoothly. So let's remind folks the dental clinic, Mission of Mercy. It is made possible by the tremendous efforts of the entire community. That's really correct. Coming together. The event for 2015, what is your goal for serving clients at that event?
We hope to serve close to 2,000 patients. We hope to treat 2,000 patients with an hour of care. We hope to do that with the generous donation of volunteer time of about 1,200 people from the community and the resources of the community to support our cash budget of about $175,000 and the in-kind and donations beyond that.
So let's tell viewers, because our goal right now, especially, looking at, this time of the year, we're working through the winter months, and people will have time that they can think about what they'd like to do to give back to the community. This will be a perfect example of a way that maybe a business could come together and either make a financial contribution or commit some volunteer hours of staff. Tell me a little bit about some of your volunteer activities. I know that you personally made the rounds to Rotary clubs and other civic organizations to engage groups of volunteers. Tell me a little bit about how those 1,200 people were identified and came together last time.
A lot of it was outreach on our effort to speak to community groups and organizations about what we were doing. Once you tell the story, I think people connect with the idea of what the need is. And it reaches them. So we're very willing and able to get out, reach the community, go to community organizations, tell the story. And what that does, it starts to spread the message, and then it's word of mouth. And because we have done this one time, we now have some experience in the community, and we have 1,200 people with their own experience stories telling their families, friends, and neighbors. So I think the word of mouth is a tremendous help to get the word out there about what's needed. But we're glad to get on the road and tell the story any chance we can.
And we're happy to be spreading the word. Yes. And so as we wrap up today, Dick, I'd like to just, hit the high points for our viewers who may just be catching the end of this broadcast. We're talking about Mission of Mercy. We are planning that community event in April of 2015.
April 17 and 18 of 2015.
6 a.m.
The clinic begins at 6 a.m.
The volunteers will be there much earlier.
Some of the volunteers will be there at 3:30 in the morning because we'll actually begin to bring patients in at 5 a.m. to stage them and get them through the registration process to begin the clinic at 6 a.m. So volunteers will be there early in the morning.
But that's perfect for some folks.
It is, and it's an opportunity for volunteers to work a small amount of time and touch tremendous lives.
And we encourage everyone to go to www.missionofmercy Eastern Shore.
Oh, it's actually Eastern Shore. missionofmercy.org.
And they can get all the information, volunteer, make a financial contribution towards that goal of $175,000. Thank you so much for your time today, and we're thrilled to help you spread the word on this program.
Thank you for being a great partner.
And you're watching Community Foundation Spotlight. I'm Erica Joseph, and it's been a pleasure to spend some time with you to spread the word where our focus is on philanthropy.
Would you like to see your community organization or nonprofit group featured on PAC 14? To get started, contact us at 410-677-5014 or visit our website at www.pac14.org. PAC 14 is a great way to connect with your community.